Patient presents to the emergency with hypotension, oliguria. There is a tachycardia. So blood pressure is low, urine output is low. What do you do in a patient with shock? You give him a bolus IV fluid. Bolus means 250 cc. So you give him a bolus of ringer lactate. You can give normal saline also. After giving him the bolus, his pulse improves a bit, BP improves a bit, urine output improves a bit. So things have improved. He has responded to your bolus IV fluid. But within 30 minutes, the parameters decline again. What would you categorize the patient's response? So definitely he did get better, but then he fell again. What does it mean? This is called as a transient responder. Okay, these are terminologies as clinicians you must know. So this is a transient responder. Now, what is a responder? Any patient who is having hypovolemia or shock, you give him a bolus IV fluid, and that bolus, depending on the age of the patient, is usually 250 to 500 ml. By definition, 250 ml first, and then you decide. Now, when you give the 250 ml bolus, and there is a sustained improvement in his parameters, he is called a responder. But the scenario we gave, where it improves, but then it declines again, that is called a transient responder. That means the rate of there is some ongoing hemorrhage. It's not that much, but it is still ongoing. But you give him the IV fluid bolus and there is no improvement. That means the hemorrhage is much more than the fluid you have given. That means there is a classical ongoing hemorrhage. This person will require something more drastic. Maybe you'll have to start him on pressor agents, and definitely you'll have to find out the source of the bleed and stop the bleeding, because just giving him fluid after fluid is not going to solve the problem. It means there is an ongoing hemorrhage. That's why he's a non-responder. These are terminologies as clinicians we must be very well aware of.